One of the issues that I think people are concerned about when they decide to leave the United States and go where they're treated best is healthcare. People have told me, Andrew, you're going to regret leaving the United States because you've given up your access to the #1 healthcare system in the world. But unfortunately, the United States is far from #1. In fact, according to the World Health Organization, the only thing it's #1 in from a health perspective is spending and cost of care. And so if you're considering moving overseas, but your concern is how am I going to get treated if I get sick? How am I going to maintain good health? Then in this talk, I want to share with you all the different data points that I've seen that would perhaps suggest you should move overseas not just for lower taxes or a better quality of life or lower cost of living or simply more peace, but moving overseas because there are actually, by one metric, 36 countries in the world with better health care than in the United States. Hi, I'm Andrew Henderson, and here at Nomad Capitalist, I've spent over a dozen years traveling the world, building a network, and now building a team of nearly 30 people who help 7- and 8-figure entrepreneurs legally go where they're treated best, whether it's lower taxes, having more options, or having better health care. You can learn more at nomadcapitalist.com. Now, one thing we talk about here at Nomad Capitalist is the value of compartmentalization, treating the world like a buffet, because this is not the world that existed in the 1980s or the 1950s. You have countries that have come out of practically nowhere and become powerhouses in many cases, not only economically, but in other areas like healthcare, in livability. I live in Malaysia part of the year, a country that you wouldn't even think about when I was born. Now it's one of the most livable places, not only in Asia, but in the world, in my opinion, and a great place for potential retirees to consider. But our idea of compartmentalization is validated by one of the analyses that a group called the Urban Institute did when they looked into healthcare in the United States back in 2009, where they said the U.S. is very good for cancer care, but they seriously lag in the developed world among needless deaths for treatable and preventable diseases and conditions. And so it's possible that there are some things that you would want to go to the United States to receive care for. Now, when you look at a list of medical tourism hospitals around the world, most of them are not in the West, and I think you can get pretty good cancer care, whether it's in Istanbul, whether it's in Dubai, whether it's in Singapore. I've even received excellent care, of course, not only in Malaysia, excellent care at hospitals like Prince Court, but I've had excellent care in places like Mexico. And so I think a lot of the countries that you might not consider are actually outperforming the United States in terms of care. But there may be some things where, okay, for that you want to be in the U.S. Let's go through some of the different studies which indicate why, if you're concerned about leaving the U.S. for health reasons, you probably shouldn't be. The first is from a group that I probably don't agree with on a lot, called the Commonwealth Fund. They put together a report a couple years ago where they said that the U.S. Comes in last among 7 developed countries. And speaking to the #1 piece, the U.S. is #1 in terms of money spent per capita on healthcare. In this study, $7,290 per capita, but it ranked 7th behind Australia, Canada, Germany, the Netherlands, New Zealand, and the UK when it comes to quality, efficiency, access to care, and ability to lead long, healthy, and productive lives. The mortality rate in the United States is actually, in some metrics, heading in the wrong direction. And so in the Netherlands, which spends only $3,800 per capita on healthcare, they ranked the first. Now, I'm always a little bit suspicious of these reports where they only rank Western countries because I believe you should go beyond the familiar. So let's go on to the next report, which is that the U.S. ranked last among 11 countries in the highest rate of preventable death. This comes from Becker's Hospital Review. They did this back in 2018. And the 3 things that you need to know are, #1, the U.S. ranked last place among 11 countries for health outcomes, despite having the highest cost per health earnings. #2, the U.S. had the highest rate of mortality amenable to health care, meaning more Americans die from poor care quality than any other country in the study. These are Western countries, developed countries. And #3, poor access to primary care in the U.S. has contributed to inadequate chronic disease prevention and management, delayed diagnoses, and safety concerns, among other issues. And so certainly one thing that I see living around the world and having lived in the U.S. for much of my life and now being elsewhere, is certainly every country has its share of bad food. But the United States does seem to be rather unique in terms of the ingredients that go in the food, the ingredients that are allowable in the food. I mean, things like high fructose corn syrup. I'm not a super person involved in the GMOs or anything like that, but I can tell you, when I eat a tomato in Europe, it actually tastes like a tomato. And it doesn't make my tongue feel like it has a rug on top of it. It actually tastes like a real tomato, and I feel great. When I eat a tomato in the United States, it tastes terrible, and I just feel badly afterwards. And I think a lot of the food that's consumed in the U.S. leads to more chronic conditions. Not every other country is perfect, but not as many people walk in the United States. Not as many people are active. It's a car culture. I think that leads, along with the food supply, along with the culture, just to more chronic disease, certainly more obesity, and a lot of other conditions. And I think that the idea of living overseas perhaps prevents, by just the nature of the changing culture and the changing lifestyle, prevents some diseases, on top of the fact that in this report, among developed countries, the United States had the highest rate of needless mortality when you go to seek health care. Now, let's go to the next report. In 1990, this report ranked the United States 6th. Now it's 27th. This is according to Business Insider, where they say that U.S. investments in healthcare and education haven't changed much in the last 3 decades, and it's putting the country far behind its peers. A study ranks the U.S. 27th in the world, behind a bunch of Nordic countries like Finland, Iceland, Denmark, and the Netherlands, as well as even developing countries. Because, of course, their argument is that the U.S. lacks universal health care. We don't necessarily have to agree with that. But they're basically arguing how the quality of care in the United States has stayed the same, yet so many other countries now are surpassing it. So in this case, I guess 21 different countries have improved their care enough to where they are now better than the United States, and they've done that in the last 3 decades. They also talk about education, how the U.S. is very, much in the middle in terms of test scores globally, and that perhaps there's some kind of correlation with that. But in terms of, the quality of healthcare, they are actually being beaten by some developing countries right now. Now, perhaps the most interesting and most complete report was a report from the World Health Organization called Measuring Overall Health System Performance Across 191 Countries. And so my team and I went through this and looked at a couple of different interesting statistics that the WHO put together, looking at the entire world. So certainly one of my frustrations when you see comparisons is they're largely Western-centric in any kind of index, whether it's the best places to retire, best places for healthcare. You'll see 7 or 11 countries with high taxes, generally socialized medicine in this case. And so, okay, the U.S. doesn't do well against those, but doesn't it do pretty well globally? Well, not entirely, or at least it does just as well as many other countries that you might not have even thought about before, or you would have expected much worse outcomes. And so I personally don't have this great animosity towards socialized medicine because I just get to choose where I live. If I want it, I'll live in that country. If I don't, I'll live in a country where, as I do, I pay for all my care privately, and it's very affordable. So let's go through and look at the top tier of 9 tiers that the World Health Organization put together in terms of measuring performance. The top tier was the Frances, the Spains, Norway, Iceland, Japan, some of the ones we talked about. Chile as well, actually. The second tier was the Canadas, the Australias, the UKs. The third tier, this is where the US ranks. 3rd out of 9, okay, not so bad. It's a solid C+. But who else ranks in that 3rd tier? Poland, Malaysia, I like Malaysia, Venezuela, Paraguay. These are the countries that are in the same tier. Thailand and Cuba are also in that 3rd tier. So if you're looking for equal quality care to the United States, you can do better in most all of Europe, including some of Europe's tax-friendly countries like Andorra. Portugal could be tax-friendly for new arrivals. There's plenty of places in Europe to get good quality care. Heck, Venezuela is tied. I'm not sure how much I believe that anymore, but Malaysia, Thailand, I absolutely believe that, and I believe you'll get faster, more efficient care. The report also places the United States 37th in terms of overall efficiency. That was the big metric. In that case, they're behind Andorra, Singapore, Portugal, Cyprus, countries we've mentioned, countries that people might be interested in living in, right? These are European countries or very developed countries, Singapore, And again, some of these could be tax-friendly countries, so we're off to a good start. But it's also ranked 37th behind Colombia, the United Arab Emirates, Morocco, Dominica, where you can get your citizenship by investment, Costa Rica, popular retirement destination. The WHO said, in terms of overall efficiency of the care, the U.S. ranked below all of those countries. Now, for comparison's sake, the U.K. was 18th, Canada was 30th, and Australia was 32nd. So the Western world in general, it's not doing terribly, but the idea that you're simply not going to get care anywhere else, freaking Dominica beats the United States, okay? Listen, I love Dominica, and I love the Dominican people also. But it's a good citizenship by investment program. But does anyone watching this actually expect that Dominica would have better health care on a report by the WHO? Now, I know some people it's a conspiracy theory. Okay, there's 4 researchers who went through and did a very detailed analysis. You can look up the report online. I understand certain people have misgivings now about the WHO, but this is a pretty cut and dry report. Now, let's take it to the final level. Performance in terms of the level of health, just in the system in the country overall, the United States now goes down to 72nd in terms of actual health performance. Now we're behind Sri Lanka, Macedonia, Iran. So in terms of overall health, obviously, I think people realize that the United States is not the healthiest country. It does have one of the highest levels of obesity, and certainly that could be largely preventable. Although I do think that some of the food, when I go overseas, I eat at times a lot of food. And what's interesting, when I was in Latin America, when some of those same kind of foods, I just was putting on a suit that I had purchased in Mexico. I lost a lot of weight when I was no longer in Mexico and Colombia because I was eating foods that were similar to the foods I would eat in the United States. Now I've been in Europe, I've been in Asia, and I lost a lot of weight. I got kind of chubby. We could all lose a pound or two, right? But when I was in that part of the world, it certainly affected me in a way that if I ate similarly in other parts of the world, wouldn't be an issue. So that's part of where the U.S. ranks 72nd in terms of not only, how long do you live, what's the quality of life, how good is your health, but how good is the healthcare system. And so I think that the lesson of all of this is that, in terms of developed countries, it's more expensive. That is certainly an issue. People are paying a lot for healthcare in the United States. Are you going to move to the Netherlands or to France to pay through the nose in taxes and get your free healthcare? No, you probably shouldn't if you're a successful person. But there are places where you can go. Obviously, there are pockets in a lot of different countries, such as my experience in Mexico. I've had experiences in Panama, in Prague. All over the world, I've sought medical care, and I've generally found it to be pretty good, and it's solved my problem. Some of the best care I found has been in Dubai, Kuala Lumpur, and Bangkok. I have not really gotten much care in Singapore, but certainly that is generally top-notch as well. And so I think that the idea of living in Europe or Asia as part of your, whether it's in your working years or as part of your retirement, is probably a great way to live a healthier lifestyle, lower your taxes in the process, and be able to get much more affordable, not only health insurance, but health care that you can pay for out of pocket for whatever it is that you may need. And hopefully dispelling the notion that the United States is most certainly not number one in health care and that other options do exist that you can certainly feel comfortable using if you do decide to live outside of the country. How can Nomad Capitalist help you? 4 ways. Number 1, subscribe to our channel and click the notification bell to make sure you get our new video every day. Number 2, get a copy of Nomad Capitalist, the book. You'll learn a lot of my personal experiences over a dozen years of studying this stuff, as well as exactly some of the strategies that you can use to build your Nomad Capitalist plan. Number 3, if you're not sure where to start, but you want to come and learn from my team and I, you want to come and mingle with like-minded people, learn more about our live conference, Nomad Capitalist Live. It's coming up soon. And number 4, if you want some help right now because you've got a burning issue, you need something solved, you want to lower your taxes, get a second passport, or build the Nomad Capitalist lifestyle of your dreams, go to nomadcapitalist.com and click on Become a Client.